And I figured I'd be one of the 9% who would be ready. But prolonged labor, assisted delivery, major postpartum hemorrhage, and PTSD had other plans. So what I needed to recover physically and mentally didn't exist. And so I made it. Thank you. I'm Wendy Powell. I'm founder and CEO at MUTU System. So why did I make this? I made this myself. These two babies are now 16 and 18. And when I had them, I was a certified postnatal fitness instructor. And I figured I'd be one of the 9% who would be ready. But prolonged labor, assisted delivery, major postpartum hemorrhage, and PTSD had other plans. So what I needed to recover physically and mentally didn't exist. And so I made it. I filmed the first version of MUTU in my garden with a camera taped to a tree. I Googled how to make a website and I started blogging into the ether. Fast forward 10 years. MUTU is now a professionally produced, evidence-based digital membership platform and community. It is a recovery and exercise program with proven clinical benefits and more than 100,000 paid users. This business is live, it's cash flowing, it's fully scalable. We are bootstrapped, we are profitable, and we are debt-free. So who's using it? Well, MUTU delivers at-home, inclusive, accessible virtual education and exercises. The engaging, clear, and user-friendly video platform means that users actually get results. The women's health physiotherapist who led our hospital trials, this was during lockdown, she said she was amazed by the participants' compliance to MUTU. 70% of the pilot group were still doing the exercises at least 3 times a week after 6 and even 12 weeks of the program, which is way more than is usual for PT-led exercise. Users love it. We're rated excellent on Trustpilot, and we've got further multiple 5-star review ratings across Facebook and Google and across other reviews. These are symptoms that women believe are inevitable after giving birth. They don't talk about them, there is stigma and there is shame. Many women feel there's nothing they can do about it. They're scared to do any exercise at all, and they often feel alone in their suffering. And so community and education and expert human support are key features of MUTU, meaning that participation is empowering and effective for our users. Here's just a taste of the results from our hospital trials during lockdown with new mums. 96% of those that started with urinary leakage saw improvement by 6 weeks use of MUTU System. And of the users experiencing back pain, a very common problem for postpartum women, they were reporting no symptoms after 3 to 6 weeks of doing the exercises regularly. How big is this problem really though? Well, it's huge, it's prolific, and it is expensive. 1 in 3 women, 1 in 3 mothers have urinary leakage. Half of them will deal with some level of pelvic organ prolapse. Incontinence doubles the risk of postnatal depression. These issues carry stigma and shame, discomfort and pain. And the consequences of that for them are reduced self-esteem, reduced exercise and reduced hydration and reduced happiness. We have so far reached tens of thousands of women with our direct-to-consumer offering, but we want to impact millions. We're already in partnership with a major European health and hygiene corporate. We have a pilot pending with a major US health insurer, and we are compliant, full governance and tested by the UK NHS and working toward procurement deals there. We believe that millions of mums need and deserve the confidence, the comfort and the dignity of a body that works for them and that feels good. So if you are leaders in healthcare payer systems, corporate wellness payers, or partners who can scale with us, then we would really love to talk to you. And I welcome your questions. Thank you.
Wendy, awesome presentation. We actually are going to start with a question from the audience for you. So from Dylan, have you considered partnering with other maternity/family building companies?
Absolutely, and really happy to. So yeah, there are so many services and products that are complementary to what we do and that are talking to the same people. These are issues that affect literally every woman that has a baby. So we are really open to those sort of partnerships. Yes.
When it comes to your go-to market, we've seen companies very successfully do what you're doing. Take a company that they started off with in consumer and then prove out the model, and then now use enterprise to accelerate that plan. So when you talk about working with a US insurer and expanding that strategy, like how would that work with a payer?
So super simple, actually. So in terms of so the healthcare professional, the payer, the employer would refer a patient or a member to MUTU, and they would do that directly through email, through text, or through QR code. So it's literally a link that would come to us, and from there we take care of her. So that member would then click through to a unique co-branded landing page that we would create, fills out a short form and signs up. We take care of her. So what happens is that the member would receive secure login credentials. They get immediate access to the full MUTU experience. And what we do as well is guide our users through a baseline survey and then through 3, 6, and 12-week surveys of symptom improvement. And that data can be fed back to the payer, whether anonymously or not, whatever is appropriate. So all of that's compliant, and the data is obviously GDPR compliant, but so we can then pass that data back to the payer. So it really is literally a link, and we take care of her.
Wendy, we have a question from Esther Dyson in the audience. For how long after the birth does the mother use
baby that they have? So they come back when they have more children. And very often these things are, we often just talk about core and pelvic floor work as similar to cleaning your teeth. You don't stop when your teeth are clean. You kind of have to keep doing it. So this is a lifestyle, and it's an adjunct to other workouts, other exercise, and other activity. So there is no too early and there is no too late. Ideally, most women tend to come to us in the sort of 6 to 12 months post-birth, but literally any time in that journey is perfectly appropriate, and it'll be effective.
Wendy, obviously community is really important to us here at Startup Health, and you mentioned that as a mainstay of your offering. Could you talk about how community helps you differentiate from the other solutions that are out there and why it's so important to your model?
Yeah, absolutely. As I said, these issues they're not just physical. They affect everything about a woman's life. They affect intimacy with a partner. They affect how confident she feels in her life, in community, in work, in employment. So they're really affecting everything. It's confidence and it's self-esteem. So that feeling like you're dealing with that alone, or that it can't be talked about, or that it's embarrassing or shameful in some way, is really common. So community is incredibly important. We have a section of our membership platform called MUTU Connect, and that's where our users and members help each other and support each other. They post pictures and updates, and they can also talk to myself and my team. So we go in most days and we answer their questions about how they're getting on. So that community element of not only community in the sense of you're not alone, that bit's hugely important, but on top of that, having an expert answer your questions and guide you.
Wendy, who are your competitors, and what would you say your competitive advantage is?
So competitors kind of cover physical therapy would sort of be a competitor, although that's complementary. There are other exercise programs out there, of course, but generally without medical referral, and certainly without trials or governance in the way that we do because of our work with the NHS in the UK. Other competitors or other solutions that women might turn to might be internal devices for pelvic floor exercises, sometimes used alongside an app, often purchased online with no medical guidance. Or, of course, the alternative is surgery in more extreme cases, and that kind of then you get into not only expensive and invasive surgery, but actually very controversial mesh surgery, which is used for incontinence and for prolapse. So it's the differences are many, but MUTU is easy to use, it's accessible, it's at home. That's another element. There are many reasons why women don't present in person for some of these sort of issues, whether that be cultural, language, religious, or simply just embarrassment. So having something that they can follow at home and ask questions from an expert at home is hugely beneficial. There's no side effects, nothing's inserted, there's no surgery, and they get ongoing human support. So lots of
Wendy,
differences.
yeah, we have one final question from the audience. I just Googled and see that Princess Kate has used MUTU. Is that really true?
Well, I never thought I'd say this, but according to the Daily Mail, yes. So whilst I would not normally quote that newspaper, on this occasion, I'm going with what they told us. We also know that we do know for sure that Pink, as in Rockstar Pink, has also used MUTU System. Her trainer has worked with us. So yeah, we've got a couple of famous moms in there.